Okay, so my name's Chloe, and I'm gonna be your nurse. We already did the physical assessment, but can you tell me your name and date of birth?
Miles Miller, I have 8/20/2002.
Okay, and just so you know, your privacy is our main goal, and you don't have to hear the teaching if you don't want to. So I was looking in your medical history and saw that you had a hiatal hernia. How long have you had it?
2 years.
Okay, and so I'm just going to kind of tell you a little bit more about the hernia. So, a hiatal hernia happens when a part of your stomach goes and breaks through your diaphragm, which your diaphragm is the muscle that connects your abdomen to your chest. So, the hernia is breaking through your abdominal wall into your chest cavity, which causes some discomfort. Um, it's a very common diagnosis and issue among people. Around 50% of people have it. Majority of people are over the age of 50, but there are some risk factors that make younger people have it. So, some of the risk factors include smoking, alcohol usage, chronic coughing or chronic vomiting, anything that causes a lot of pressure on the abdomen and the stomach that can cause it to penetrate. So, some more is obviously with the older population, their muscles weaken, and so the abdominal muscle can weaken, causing the hernia to occur. Also, genetic factors are also a link to it if it runs in your family. So, some signs and symptoms include acid reflux, which is like the regurgitation of sour fluid, or belching. You can also have some chest pain, chest discomfort. You can have some heartburn, abdominal pain, wherever your hiatal hernia affects you. So, you can also feel short of breath, or you can feel full quickly after eating. So some of the prognosis is pretty good. There are a lot of medications out there and dietary changes and lifestyle habits that you can change to help your quality of life. Some treatments also include, like if you have a mild hernia, antacids, which are, you can get them over the counter, such as Pepto-Bismol, Alka-Seltzer, Tums, any of those. They neutralize the stomach acid and kind of line and coat the stomach, which eases your pain. Also, if you have a little bit worse than that, you might need prescription medicines. And one of the most common prescription medicine is a proton pump inhibitor, which is Protonix, which is what you take. If you have a more severe, you might need surgery, but they usually don't like to do that on younger people. So, some lifestyle changes that might help you, that you can do to help your hernia and prevent it from getting worse, is maintain a healthy body weight. So, obesity, it puts more stress on the body everywhere. And so, if you have stress on the body, in your stomach or abdominal region, it can cause the hernia to worsen. So maintain a healthy weight. Maintain a good diet. So there are some trigger foods that worsen the hernia and worsen your symptoms, such as spicy foods, acidic foods, like a lot of citrus, or like orange juice, lemon juice, lemonade, anything like that. Anything citrusy and acidic can worsen it. Also, caffeinated beverages or carbonated beverages that can worsen, like belching. Also, you need to avoid smoking and drinking alcohol. And you do not need to lay down directly after eating. You need to sit up and let your body digest your food. So you need to sit up for at least 1 hour, but it's recommended 2 to 3 hours. So you can find some additional information about hernias at the Mayo Clinic online or the Cleveland Clinic online. That's where I got some of my information. So your medication is Protonix. It is a proton pump inhibitor. It helps by neutralizing the stomach acid, which helps with acid reflux, which is one of the symptoms of your hernia. So you need to take it every day at the same time, 30 minutes before you eat. And you do not need to stop taking it without talking to your doctor. So, do you have any questions for me?
Mm-mm.
Okay, thank you.